Hi, I'm Paul Glassman, the Director of Community Oral Health at the University of Pacific School of Dentistry. We just finished a legislative briefing here. We were speaking on behalf of the California Task Force on Children and Workplace Wellness. And this was a legislative briefing about the virtual dental home project that we're directing out of the University of Pacific School of Dentistry, actually the Pacific Center for Special Care there.
Elementary kids were having 6 and 7 extractions because the teeth can't get saved. A lot of these kids don't participate in the classroom because, again, they're ashamed about the condition of their mouth. That impacts them academically, it impacts their self-esteem, and I think all of us know in order to be successful you have to have some self-esteem. It takes...
Than whites. In total, 63% of kids, so 2/3 of kids, have filled cavities.
Actually has a pretty good view of this patient, what the patient's like in the community. Even though the dentist is not in the community, they actually can see the patient, get a pretty good view of what they're like, and help make some decisions. And so at the briefing we had several people on the panel. We had Dr. Len Finocchio, who works for the California Healthcare Foundation, and he gave some of the background about why there's such a problem in California. He talked about 25% of kids have never seen a dentist, and some other statistics that demonstrate that we really have a very difficult situation for low-income children and other populations in California, and that the current system is not really working very well for a lot of these groups of children and adults. And then we had some people from the Twin Rivers School District, and that's one of the sites where we're doing the virtual dental home projects. So we had the Michelle Rivas, who's the president of the school board, and she talked about the perspective from the school board and her own personal perspective, and how that they are a school district that really recognizes that kids who are not healthy, who are having dental pain, who are missing school because of dental problems, they're not going to be able to learn and be successful. And so they've been very supportive in wanting to see this project move forward. She had some compelling pictures of children who don't smile, basically because they're ashamed of the way their mouth looks, and kids who are afraid to go to the dentist because their parents have never gone, and they don't really know what it's about, and why it's such a difficult time getting some of these kids to get actually into dental offices. And then we heard from Benita Mallory, who's a school nurse, and again she had stories about kids who just really affected their ability not just to learn in school, but actually even to attend school. One story she told about a young man who was in the first, second grade. He was missing many, many days of school because of dental pain and problems and infection. And so it was really a huge impact on his life and his ability to be successful in life. And then I had the opportunity to present the actual project itself, the virtual dental home, and this project where we're creating referring to a geographically distributed but collaborative system where we have dentists in their offices working with hygienists and assistants in schools and in nursing homes and places where people live who really can't get into dental offices so easily. And of course our hope is to create a system where through this geographically distributed but collaborative system using telehealth technology, we can actually produce more oral health at a lower cost than the current systems of care.